Question 1. A fixed amount that a patient pays for a covered healthcare service at the time of the visit, such as $25 for an office visit, is known as A. Deductible. B. Coinsurance. C. Copayment. D. Premium. Answer: C. Copayment. This question tests your understanding of basic patient financial responsibilities. The keywords fixed amount and at the time of the visit are crucial clues pointing away from amounts that vary or are paid later. A copayment, or copay, is a set fee the patient pays directly to the provider for a specific service, as determined by their insurance plan. For example, a patient's plan might require a $25 copay for a primary care visit and a $50 copay for a specialist visit, regardless of the total cost of the service. An easy way to remember this is that you pay the copay at the time of service. Question 2. Which claim form is used by physicians and other non-institutional providers to bill for their professional services? A. UB-04. B. CMS-1500. C. ABN, Advance Beneficiary Notice. D. EOB, Explanation of Benefits. Answer: B. CMS-1500. The concept being tested is the correct usage of standard medical claim forms. The key phrase, physicians and other non-institutional providers, specifies that the services are professional, not facility-based. The CMS-1500 is the universal claim form used by professionals like doctors to bill insurance companies for services rendered in an outpatient setting, such as a private office or clinic. In contrast, the UB-04 is used by hospitals and other facilities for their charges. Think of it this way: the CMS-1500 form is for the professionals who and what, while the UB-04 is for the facilities where. Question 3. What does the acronym HIPAA stand for? A. Health Information Privacy and Affordability Act. B. Health Insurance Portability and Accountability Act. C. Healthcare Information Patient Access Administration. D. Health Insurance Patient and Accountability Act. Answer: B. Health Insurance Portability and Accountability Act. This question tests foundational knowledge of the most important healthcare privacy law. While all the options sound plausible, knowing the correct full name is a critical part of medical billing and coding compliance. The Health Insurance Portability and Accountability Act, HIPAA, is a federal law that established national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. It governs patient privacy and data security, and violations can lead to severe penalties for providers and organizations. A simple tip is to focus on portability and accountability, the two key pillars of the legislation. Question 4. In the revenue cycle, the process of verifying a patient's insurance coverage and benefits before a service is provided is known as A. Charge capture. B. Adjudication. C. Eligibility and benefits verification. D. Accounts receivable follow-up. Answer: C. Eligibility and benefits verification. This question focuses on a critical front-end task within the Revenue Cycle Management (RCM) process. The clue is the timing. This happens before a service is provided. Eligibility and benefits verification involves contacting the insurance company to confirm that the patient has an active policy and to understand what specific services are covered, as well as their copay, coinsurance, and deductible amounts. This step is crucial for preventing claim denials and ensuring the patient is aware of their financial responsibility up front. Remember this simple rule: always verify before you provide the service. Question 5. Which code set is used to report medical procedures and services performed by physicians? A. ICD-10-CM. B. HCPCS Level II. C. CPT, Current Procedural Terminology. D. NDC, National Drug Codes. Answer: C. CPT, Current Procedural Terminology. This question tests your knowledge of the different code sets used in medical billing. The keyword to focus on is procedures and services, which distinguishes this from diagnoses or supplies. CPT codes, maintained by the American Medical Association, AMA, are 5-digit numeric codes used to describe the services a provider performs for a patient, such as a new patient office visit, 99203, or an appendectomy, 44,950. Think of it this way: the diagnosis code, ICD-10-CM, explains why the patient needed care, while the CPT code explains what the provider did. Question 6. A claim that is submitted to an insurance carrier without any errors in the data is called A. Pending claim. B. Denied claim. C. Clean claim. D. Dirty claim. Answer: C. Clean claim. This question assesses your understanding of claim submission terminology. The defining phrase is "without any errors," which is the key characteristic of the correct answer. A clean claim is one that has all the required information completed accurately, including patient demographics, insurance details, diagnosis codes, and procedure codes, and can be processed by the payer without needing additional information or correction. Submitting clean claims is the primary goal of any biller, as it leads to faster and correct reimbursement. The best way to remember this is to think that a clean claim goes through the system cleanly, without getting stuck. Question 7. The document sent by a commercial insurance company to a patient explaining how a claim was processed is called A. Remittance Advice, RA. B. CMS-1500. C. Advance Beneficiary Notice, ABN. D. Explanation of Benefits, EOB. Answer: D. Explanation of Benefits, EOB. The concept here is differentiating between documents sent to patients versus those sent to providers. The key clue is that the document is sent to a patient. An explanation of benefits, EOB, is a statement from the insurance company that details what costs it will cover for medical care, how it calculated the payment, and what portion of the bill the patient is responsible for. It is not a bill, but rather a summary of the claim transaction for the patient's records. Remember this distinction: the EOB goes to the patient, while the similar remittance advice, RA, goes to the provider. Question 8. The term medical necessity refers to A. The provider's preference for a particular treatment. B. Services or supplies that are appropriate and needed to diagnose or treat a medical condition. C. Any service requested by the patient, regardless of their condition. D. Services that are covered under any insurance plan. Answer: B. Services or supplies that are appropriate and needed to diagnose or treat a medical condition. This question tests the core concept of medical necessity, which is the foundation of all insurance reimbursement. The keywords appropriate and needed highlight that the care must be justified by the patient's diagnosis. Medical necessity is the principle that a procedure or service must be linked to a supporting diagnosis code, ICD-10-CM, to be considered for payment by an insurance company. For example, billing for a chest X-ray is medically necessary for a patient diagnosed with pneumonia, but not for a patient with a sprained ankle. The key takeaway is: no valid medical reason, no payment. Question 9. What is the primary purpose of the ICD-10-CM code set on a medical claim? A. To report the services and procedures performed. B. To describe durable medical equipment. C. To establish the medical necessity for services. D. To identify the place of service. Answer: C. To establish the medical necessity for services. This question focuses on the specific role of diagnosis codes in the billing process. While procedure codes, CPT, state what was done, ICD-10-CM codes state why it was done. This why is the justification for the entire patient encounter, thereby establishing medical necessity for the services rendered. For example, an ICD-10-CM code for acute bronchitis, J20.9, tells the payer why the physician performed an office visit and ordered a breathing treatment. Think of the diagnosis code as the story that justifies the actions taken by the provider. Question 10. The process of obtaining approval from an insurance carrier before a specific service or procedure is performed is called A. Adjudication. B. Prior authorization. C. Claim scrubbing. D. Credentialing. Answer: B. Prior authorization. This question assesses knowledge of a common utilization management process. The key phrase, before a specific service is performed, indicates a proactive step required by many insurance plans. Prior authorization, also known as pre-authorization or pre-certification, is a requirement from the health plan for the provider to obtain approval before delivering certain services, such as expensive imaging tests or surgeries. Failing to get prior authorization for a required service will almost always result in a claim denial. The best way to remember it is, you must get authorization prior to the service. Question 11. Which government-sponsored health program primarily provides coverage for low-income individuals and families? A. Medicare. B. TRICARE. C. Medicaid. D. Workers' compensation. Answer: C. Medicaid. The concept being tested is the ability to differentiate between major government health programs based on their target populations. The defining clue is low-income individuals and families. Medicaid is a joint federal and state program that helps with medical costs for some people with limited income and resources. In contrast, Medicare primarily covers people over 65, and TRICARE covers military personnel. Always associate Medicaid with income-based eligibility criteria. Question 12. In medical billing, A/or stands for A. Adjudication review. B. Annual report. C. Accounts receivable. D. Authorized representative. Answer: C. Accounts receivable. This question tests your knowledge of fundamental billing and accounting terminology. A/R is one of the most common acronyms you will encounter in the business side of healthcare. Accounts receivable, A/R, refers to the money owed to a provider's office for services that have been rendered but not yet paid for by patients or insurance companies. Managing the A/R, including following up on unpaid claims, is a critical back-end function of the revenue cycle. A simple way to remember it is, A/R is the money the provider is waiting to receive. Question 13. What is the unique 10-digit identification number assigned to all healthcare providers and required for all standard administrative and financial transactions? A. Employer Identification Number, EIN. B. Social Security Number, SSN. C. National Provider Identifier, NPI. D. UPIN, Unique Physician Identification Number. Answer: C. National Provider Identifier, NPI. This question tests your knowledge of standard provider identification numbers mandated by HIPAA. The keywords unique 10-digit and required for all standard transactions point directly to the federally mandated identifier for healthcare providers. The National Provider Identifier, NPI, is a unique identification number for covered healthcare providers, used in all administrative and financial transactions to simplify processes and prevent fraud. For instance, a physician's individual NPI must be listed on a claim to identify them as the rendering provider, separate from the clinic's organizational NPI. A helpful way to remember this is that the NPI is the universal, national standard that replaced older, payer-specific identification numbers. Question 14. Which modifier indicates that a significant, separately identifiable evaluation and management (E/M) service was performed by the same physician on the same day as a minor procedure? A. -59. B. -25. C. -51. D. -24. Answer: B. -25. This question assesses your understanding of a very common CPT modifier used in billing. The key phrase is separately identifiable evaluation and management (E/M) service on the same day as a procedure. Modifier -25 is appended to an E/M code to signal to the payer that the visit was not just for the preoperative work of the minor procedure but was for a distinct medical reason. For example, if a patient comes in for a scheduled mole removal but also complains of new, unrelated chest pain that the doctor must evaluate, the E/M code for the visit would get a -25 modifier. Always think of modifier -25 when a visit and a minor procedure happen together for separate reasons. Question 15. The UB-04 claim form is used to bill for which type of services? A. Professional physician services. B. Pharmacy services only. C. Institutional and facility services. D. Transportation services. Answer: C. Institutional and facility services. This question tests your knowledge of the different claim forms and their specific uses. The key term to associate with the UB-04 form is institutional, which refers to hospitals, skilled nursing facilities, ambulatory surgery centers, and other large organizations. Unlike the CMS-1500 form, which bills for the professional's time and expertise, the UB-04 bills for the facility's resources, including room and board, supplies, and technical staff. A good way to remember this is, UB-04 is for the building and the resources within it. Question 16. The deadline by which a health insurance claim must be submitted to a payer is known as A. Filing limit period. B. Date of service. C. Adjudication period. D. Timely filing limit. Answer: D. Timely filing limit. This question covers a crucial concept in claims management that directly impacts reimbursement. The keyword deadline points to a specific time frame that must be met. The timely filing limit is the contractual deadline set by each insurance payer, e.g., 90 days, 180 days, or 1 year from the date of service, by which a provider must submit a claim. If a claim is submitted after this deadline, it will be denied for timely filing, and the provider typically cannot bill the patient for the service. Always remember to check the timely filing limits for each specific payer to avoid lost revenue. Question 17. Which code set would be used to bill for a wheelchair or hospital bed provided to a patient for home use? A. CPT. B. ICD-10-CM. C. HCPCS Level II. D. DSM-5. Answer: C. HCPCS Level II. This question tests your ability to identify the correct code set for non-physician services and supplies. The key clue is the mention of specific equipment like a wheelchair or hospital bed, which are categorized as durable medical equipment, DME. The Healthcare Common Procedure Coding System, HCPCS, Level II is used to report supplies, equipment, and drugs administered by a provider that are not included in the CPT code set. Think of HCPCS Level II codes as the system for billing stuff, like supplies and equipment, as opposed to CPT codes, which are for services. Question 18. What is the main purpose of scrubbing a claim before submission? A. To delete all diagnosis codes. B. To check for errors and ensure the claim is clean. C. To lower the charges to meet the patient's deductible. D. To send the claim to multiple insurance companies at once. Answer: B. To check for errors and ensure the claim is clean. The concept tested here is a key quality assurance step in the billing process. The term scrubbing is industry slang for reviewing and editing a claim to identify and correct errors before it is sent to the payer. This process is often automated by software that checks for common issues like invalid diagnosis codes, mismatched patient information, or missing modifiers. The goal of scrubbing is to increase the likelihood of the claim being accepted and paid on the first submission, making it a clean claim. Think of it like proofreading an essay before you turn it in to catch any mistakes. Question 19. The global period for a major surgical procedure typically includes A. Only the day of the surgery itself. B. The surgery and all postoperative office visits for 1 year. C. All preoperative, intraoperative, and postoperative care related to the surgery for a set number of days. D. Only the follow-up care after the patient has left the hospital. Answer: C. All preoperative, intraoperative, and postoperative care related to the surgery for a set number of days. This question assesses your understanding of surgical billing packages, a concept known as the global surgical package. The keyword global implies that the payment for the surgery is comprehensive and covers more than just the procedure itself. For major surgeries, this package includes the initial decision for surgery, preoperative care, the operation itself, intraoperative care, and a specific period of typical follow-up care, postoperative care, which is usually 90 days. During this period, routine follow-up visits related to the surgery cannot be billed for separately. Remember that global means the payment covers the whole surgical experience, not just one part. Question 20. Which government agency is tasked with combating fraud and abuse in Medicare, Medicaid, and other HHS programs? A. Federal Bureau of Investigation, FBI. B. Centers for Medicare and Medicaid Services, CMS. C. Office of Inspector General, OIG. D. American Medical Association, AMA. Answer: C. Office of Inspector General, OIG. This question tests your knowledge of the key federal oversight body for healthcare compliance. The keywords combating fraud and abuse are the primary function of this agency. The Office of Inspector General, OIG, for the Department of Health and Human Services, HHS, is the watchdog agency responsible for investigating and prosecuting healthcare fraud, waste, and abuse. The OIG publishes a work plan each year that outlines its key audit and enforcement priorities, making it a critical resource for compliance professionals. An easy way to remember this is, the OIG is the inspector looking for problems. Question 21. A place of service, POS, code on a claim form identifies A. The type of procedure performed. B. The patient's diagnosis. C. The setting where the medical service was provided. D. The physician's specialty. Answer: C. The setting where the medical service was provided. This question focuses on the purpose of a specific but important data element on the CMS-1500 claim form. The name place of service is the biggest clue, as it directly relates to the location or setting. Place of service, POS, codes are two-digit codes used to specify where a service took place, such as an office, POS 11, an inpatient hospital, POS 21, or an emergency room, POS 23. This information is critical for payers because reimbursement rates often vary depending on the setting where the care was delivered. Think of the POS code as the answer to the question, where did this happen? Question 22. When a provider bills a patient for the difference between their total charge and the insurance allowed amount, this illegal practice is known as A. downcoding, B. unbundling, C. balance billing, D. upcoding. Answer: C. balance billing. The concept being tested is an illegal billing practice related to provider contracts with insurance companies. The key is billing for the difference between the total charge and the allowed amount. Balance billing occurs when a provider who is in network with a patient's insurance tries to bill the patient for the portion of the charges that the insurance company did not pay, beyond the patient's standard copay, coinsurance, and deductible. This is generally prohibited by the provider's contract with the payer, as they have agreed to accept the payer's allowed amount as payment in full. A simple way to remember this is, you cannot bill the patient for the balance that the insurance company contractually adjusted off. Question 23. The government health program that provides coverage for active duty and retired military personnel and their families is called A. Medicare, B. TRICARE, C. HCPCS, D. Medicaid. Answer: B. TRICARE. This question tests your ability to distinguish between different government payers based on their specific beneficiary populations. The key identifiers are active duty and retired military personnel. TRICARE is the healthcare program serving uniformed service members, retirees, and their families worldwide. It is distinct from HCPCS, which covers the families of veterans who are permanently and totally disabled or who have died from service-connected disabilities, and from Medicare and Medicaid, which serve different populations. The easiest way to remember is to associate TRI with the three branches of the military that TRICARE originally served. Question 24. A patient has an insurance policy with a $200 deductible. They receive a service with an allowed amount of $500. How much will the insurance company pay? A. $500, B. $200, C. $300, D. $0. Answer: C. $300. This question tests your understanding of how a deductible works. A deductible is the amount of money a patient must pay out of pocket for covered services before their insurance plan begins to pay. In this scenario, the patient must first satisfy their $200 deductible from the $500 allowed amount. Once the patient's responsibility for the deductible is met, the insurance company will pay the remaining portion of the allowed amount, which is $300, $500, $200. Always remember to subtract the unmet deductible from the allowed amount to find what the insurance will pay. Question 25. The process by which an insurance company reviews a claim and determines whether to pay, deny, or reduce the charges is called A. Registration, B. Adjudication, C. Copayment, D. Credentialing. Answer: B. Adjudication. This question focuses on the terminology for a key step in the claim lifecycle after it has been submitted. The keywords "reviews a claim" and "determines whether to pay" describe the payer's decision-making process. Adjudication is the formal term for the payer's process of evaluating a submitted claim against the patient's benefit plan to decide on the final payment. During adjudication, the payer checks for things like patient eligibility, medical necessity, pre-authorization, and accurate coding before issuing a payment or denial. Think of adjudication as the insurance company judging the claim.